So in Brazil, we have some new information in the last years about even the screening until the treatment of this patient and outcomes. And what brings more attention in Brazil is that around 30% only of the patients perform the screening with mammography. So this is very low compared to the data that we have, for example, in the US, that's around 8%. So the impact of that is that there is a high proportion of patients in Brazil that are diagnosed with locally advanced stage, so stage 2 and 3, especially in the public health system. So this is what we described in some studies, and this is something that needs to be improved because, of course, we know that the prognosis of the patients depends on the stage. After that, we have the treatment, the access to treatment. In general, the patients have access to radiotherapy, but especially in the public health system, we have a lack of some new drugs for the treatment of the patients. For example, pertuzumab in an adjuvant setting, and in the metastatic disease, especially also in HER2 positive patients, we don't have access until now to pertuzumab and TDM1. So it makes the public and the private health system very different in terms of patients' outcomes. So this is something that is important that we are describing in some studies, because we would like that the health authorities take a look on that, because we need to change that for the patients. So today we present the Amazona 3 study was an observational prospective study that included around 3,000 patients from around 24 institutions in Brazil. And these patients were recruited from 2016 now until 2018. And what we presented today here, a poster just evaluating how many patients from Amazonia would fill the criteria for genomic test for BRCA mutation. Okay, so we saw that around 35% of these patients would be recommended to perform the BRCA test, but unfortunately, the majority of patients don't have access to this test in Brazil. And as we know, the BRCA mutation have many impacts in the patient's life, because even you treat breast cancer, this patient have a high risk of a new breast cancer in the future, and even ovarian carcinoma. So the idea here was to highlight the need to have more access for these tests. The other information that we have from Amazonia is about the low rate of screening of these patients, the high proportion of locally advanced disease, and something that is really important is that we saw that around 42% of the patients diagnosed with breast cancer in Brazil had less than 50 years old. It means that at least 1/3 of the patients have breast cancer with less than 50 years, and these patients in the actual recommendations for screening are not covered, because in Brazil the recommendation for mammography starts at 50 years old. So we are losing 30% or more of these patients, unfortunately, in Brazil. So this is something that this kind of studies of real data are important to describe, because we need to discuss if the screening in Brazil would need to start with 40 years old. So here in San Antonio, we had two presented abstracts that were published in the New England Journal of Medicine. These are important abstracts. Especially these two studies were in the HER2 positive metastatic disease. Okay, the first one was with tucatinib. This is a TKI that was combined with capecitabine and trastuzumab. And this study in patients treated already with all the regimens that we have with anti-HER2 had a better PFS and also overall response rate. So this study probably shows a new drug that have a high potential to be approved in the next year, for example, and to be an important treatment for the patients. The other one is a phase 2 study with trastuzumab deruxtecan, okay, that was tested in patients highly treated, so they had a median of 6 treatments before. And this study was, the data is very impressive because this patient had around 60% of a response. So this is an IDC drug. And they had around 60 months of median PFS. So this is very high for patients already pre-treated with many regimens. So this is the most, I think, the most important studies presented today in HER2 positive. We have also an update information of affinity trial that is adjuvant pertuzumab for the patients. And here we have the confirmation of benefit in the invasive disease-free survival, especially in node-positive disease and hormone receptor negative. And the data presented here show that there was no difference in overall survival until now. And I think the last one that probably be a practice-changing trial, is not approved yet, was an update from Keynote 522. This is a neoadjuvant study that incorporated the first study with immunotherapy. In this case was pembrolizumab. And what was showed here was a sub-analysis of PCR. And what was very interesting to see is that as high is the stage of the disease, so stage 3, the higher is the difference between the immunotherapy plus chemo versus chemotherapy. So this was very interesting to see, and this is very good because these patients with locally advanced disease, they normally have also a higher chance of relapse. And the other data showed from the presenter is that is related to PD-L1 expression. And we have also a trend to a higher response when the patients have PD-L1 expression more than 20, for example. And this was amazing because this was around 80% of PCR, that is very high. Okay. In Brazil, we have the office from the Latin American Cooperative Oncology Group. So this is a group that helped investigators in Latin America to develop studies. So what we are doing now that will be very interesting is starting the biggest registry of breast cancer in Latin America. The name of the study is Latina. This is a real-world data that you recruit prospectively 4,500 patients in around 10 countries in Latin America. So we probably are going to have the first patients included in the beginning next year. And we hope to recruit all the patients until the end of next year. So the idea here is that we are going to describe also a lot of socio-demographic characteristics of these patients. For example, if the patients are working, if these patients are working 1 year after the diagnosis, for example, if the patients they are married, for example, in 1 year, what is happening, and of course, all the information from the clinical pathological and treatment and outcome. So this is the first big study in Latin American breast cancer, and we are leading that in LACOG. And we also have another projects that are academic studies that you test a short time of trastuzumab in patients with PCR after neoadjuvant treatment, 6 months treatment. And another one that you compare the combination of metronomic chemotherapy with hormone therapy in metastatic setting versus hormone therapy. So yesterday we saw a very interesting study here that the name is PIRL. The study was led by the JCAM, the Spanish group, and they showed in the second line metastatic disease hormone receptor positive that the palbociclib and hormone therapy had the same benefit in terms of PFS than capecitabine. So this is highlight a possibility that maybe some types of chemotherapy combined with hormone therapy would have a similar benefit than CDKs, because CDKs 4/6, we have the data is amazing, it's very good. But in countries like Brazil and Latin American countries, these drugs will take a lot of time to be approved in the public health system. So we need to find a way, and this is why we are doing this study, to try to have an opportunity for them to have a benefit also. No, I think this is a good event. The San Antonio is a good event to be for the Latin Americans. I think everybody that have the possibility and are dedicated to breast cancer should be here. It's a good event to see new information, but also to have a network with investigators and projects to perform in our countries.